For now, though, the South African Health Products Regulatory Authority, is launching an investigation into whether a substance that could cause cancer has contaminated metformin, which is metformin-containing medicines, that is. Now, metformin is a prescription medicine used to treat high blood sugar levels in patients with type 2 diabetes. But the health regulator is concerned that some of these medical products could be contained by NDMA, which is a contaminant linked to cancer. To tell us more about what sounds like a very complex situation is Mlungisi, and he's the Medicines Control Officer at the South African Health Products Regulatory Authority. Quite a mouthful, that is, sir. Thank you very much for your time. Welcome to YouTube Africa.
Thank you.
Let's start right there. The South African Health Products Regulatory Authority. I imagine plenty of people are hearing this for the first time. Give us a sense of what the body is by helping us understand the work that you do.
Thanks, Aya. SAPRA, in short, as you've said earlier, the South African Health Products Regulatory Authority. It's a body that governs medicines in the country. So from the start of research of the medicines to registration, up until the patient has finished taking the medicines. So it controls all that part of the medicines, including your reporting of your side effects and complaints and recalls and post-marketing surveillance like the one you just mentioned now.
Sure. So the substance in short focus for this conversation is metformin. I'm not even sure if I'm pronouncing it correctly. And as we've mentioned, that's used to treat diabetes, but there's also a substance called NDMA, which enters this medication. Help us understand what NDMA is and how it makes its way into metformin.
It's complex, as you said earlier. However, now the two main things I will say we focus in, as you say, is the metformin. And there's the metformin as an important medicine for treating high blood sugar. The contaminant, you've mentioning the NDMA, in full name being N-nitrosodimethylamine.
Wow.
Yes, bit complex.
We'll stick to NDMA for now.
There are studies proving that it can be carcinogenic. That means it can cause cancer over time, and also if it's over the limits that have been established globally. Currently, as you've heard the reports that metformin is contaminated with that. Luckily, it's not all metformin products. Yes, let's start there. Hence, all the regulatory authorities across the world are investigating the matter with their companies locally. Same in South Africa. SAPRA is investigating with the companies that may have that product or in combination with other products that is registered with SAPRA.
Sure.
We have started that investigation. The important thing is what you've said, that it may be contaminated, and also if it is contaminated with NDMA, the chances of causing that cancer over time are a bit limited because the quantities are very low.
Right.
However, the regulatory authorities don't want to take a risk at all times. They'll always look at if there's something that they don't want in that medicine, it must be removed.
Before we run out of time, let me quickly jump in and ask you this very briefly. If someone is taking this medication because they're on diabetes, they're listening to this conversation, obviously we don't want to cause alarm.
Yes.
What should they do very quickly?
Important question you're raising. Patients that are on this medicine mustn't stop the medicine. There are no proof that the products in South African market are affected. Hence, SAPRA is urgently investigating that. And also to add on the healthcare professionals, they mustn't stop prescribing and dispensing the medicine until SAPRA comes with information that the specific products or patches are affected, of which SAPRA will recall those patches.
Thank you very much. We're going to have to leave it there. That, of course, is Mlungisi, who's the inspectorate at the South African Health Products Regulatory Authority. A quick